Science has given us the what. We know that at least 40% of cancers are preventable, but data alone doesn't save lives. Knowledge is often trapped in silos, disconnected from the people and policymakers who need it most. What if you could combine in the same tool actionable evidence to empower people to reduce their cancer risk and priority policies tailored to the context-specific cancer burden? Regional codes against cancer bridge the gap. They provide clear prevention recommendations for people and a strategic roadmap for policymakers.
The European Code Against Cancer is a cornerstone of the European Prevention for Cancer, and I'm proud he supports this initiative.
Regional codes are developed under the World Code Against Cancer framework, a rigorous two-level architecture for global health. From rigorous scientific processes, review of the global evidence, local epidemiological and socio-economic assessment, test and adaptation of the communication. The result is an evidence-driven toolbox of cancer prevention messages adapted to the pulse of your region. Building a code against cancer is complex and requires deep structural investment in knowledge translation and independent scientific oversight.
The codes must be supported by an authoritative leader in scientific evidence, one with a global mandate and independence from vested interests. This is IARC.
Is the evidence strong enough and relevant to this region? Is it suitable and acceptable for a broad, healthy population? Is the message intelligible to a lay audience? And finally, are the international policies already in place to support individual behaviors?
The Latin American and Caribbean Code Against Cancer has been a great tool to disseminate best practices for cancer prevention and control with key stakeholders around the region.
Delivering a code is not the end of the journey. What matters is what happens when evidence meets real lives. That's why the framework places implementation science at its core, turning data into action, strengthening cancer prevention literacy, and creating impact across every context.
We're conducting a feasibility study on implementation science to disseminate the Latin American Code in primary healthcare units in the countryside of Brazil.
The science is clear, the framework is ready. Help us turn the code into a global standard, because every region deserves a science-backed future. Join the movement. Let's make cancer prevention a global reality.